All right, welcome everyone. Thank you so much for coming. If we can have a seat, we'll begin our event. Um, my name is Becky, and I'm the development assistant here at the Parkinsons Institute, and I just wanted to welcome you. I started March 12th, so I'm relatively still new here and getting the hang of things, but I am in charge of doing these events. If you're new here, we have these seminars every second Monday of the month. So if you can come, that'd be great. We'd love to share as much information to you about Parkinson's disease as we can. So I wanted to talk about this event. There were a lot of questions about what this event meant, caregiving in two parts, and I just wanted to say we're really proud to present this seminar today as a resource for you as PD patients and caregivers. We wanted to target the delicate transition between family members turned caregivers and patients. Not only are the patients dealing with a life-changing diagnosis and must make changes to accommodate to their lifestyle, but their family members, whether it's a spouse, a son or a daughter, a mother or a father, friend or neighbor, changes are coming. So you know as we do that, PD affects your whole community of family and friends, and it is a life-changing experience. And changes need to be made to accommodate to the diagnosis. We understand that the transition can be difficult and occasionally a strange experience, and we want you to know that we are here to help and give you resources, and also to give you a sense of hope for both the patients and the caregivers. We especially want to let you know that you are not alone, and that we hope that you can come out of the seminar empowered and encouraged. So the seminar is designed to help both the patients and the caregivers today. We're going to discuss caregiving and how it is to care for the caregiver, and we'll also hear from the patient's point of view. And at the end of the seminar, we'll have breakout sessions where patients can sit with patients and caregivers with other caregivers. We'll have facilitators from PPSG at that table down in the center. They'll be facilitating groups so that patients can talk with other patients about their experiences, and then caregivers can talk about their experiences with other caregivers. Just to basically let you know that you're not alone. One final word, these seminars are a bit like Las Vegas. What happens here stays here. So if you feel like sharing, it will stay here. We'll not share it with other parties. We do respect you and your communications and honor your privacy. So I sound a little weird because I'm battling a cold, so please forgive me. If you can see, or as you've seen, when you sat down, there are some green folders, and these are the folders that we provided for your information. And if you can see the agenda, we have 3 speakers at the first part of our, sorry, I'm having, so if you see the agenda, we'll have 3 speakers. We'll have 2 talking about caregiving, 1 from the patient's point of view. And then we'll have a break. The second part, we'll have Dr. Brandenburg answers your questions. And so Dr. Brandenburg is one of our in-house clinicians, and if you have a question for her regarding caregiving, you can fill out a question on this yellow slip of paper and put it on the Parkinson's Institute basket. And during the break, we'll grab maybe 4 or 5 of them. And during her session, she'll answer some of these questions about caregiving, what do you think is next step, anything that you have about caregiving. She'll come and she'll answer them. And then at the end, that's when we'll have the breakout groups. So without further ado, and during the break, we have refreshments back there. We have cookies and water, and the restrooms are down this hallway to your right. So I wanted to introduce our first speaker. His name is Nguyen. He's a licensed clinical social worker. He received a master's in social work from Sacramento State University in 1990. He worked in psychotherapy in various settings, including psychiatry at El Camino Hospital, mental health and drug and alcohol departments of Santa Clara County, hospice at Heartland and Kaiser Permanente. He's a certified palliative care social worker who holds a degree in traditional Chinese medicine and certification in biofeedback. He spent the majority of his time working on the oncology department at Kaiser San Jose Medical Center. He's been a part-time staff at the Parkinsons Institute for the past 4 years, providing individual consultations and until recently led a support group for couples. He had a small private practice, but stopped and cut back his work for the PI to care for his 3 children and his mother, who was hemiplegia from a stroke, and helps an aunt who has Alzheimer's. His talk today is about the role of mindfulness in living and caring for Parkinson's patients. If we can give him a round of applause.
Thank you very much. Welcome everyone to the Parkinson's Institute. It's my pleasure to be able to converse with you this afternoon. My name is Nguyen. I'm a clinical social worker. I'm a staff at the Parkinson's Institute. I started 4 years ago, but because of having 3 small children, and my mom had a stroke, my father prior to that also had a stroke, and my aunt also needed more help. I had to cut back quite a bit. I closed my private practice, cut back the hours, and I'm sure that my story is similar to a lot of you. You have to make a lot of adjustments in order to take care of your loved ones. But I've worked in so many different settings, and working at the Parkinson's Institute is a very humbling experience for me. Every time when I meet a family, someone who's going through Parkinson's, I always learn something, and I can't help it but to be admired how they're going through the challenges. And to me, it's like walking on a heroic journey. Nobody asks to have a disease, nobody wants to have Parkinson's, but once you have a family members or yourself having the disease, the only choice you have left is how to walk that path as well as possible. And everyone who comes here, everyone who reach out, finding information, finding answers, are all trying to walk that path successfully. I have to say that over the past several decades, there's been a lot of changes in the medical field. There are more medical advances in drugs and treatments, but at the same time, there seems to be a loosening of community networks, of churches, of extended families, and so on and so forth. So that's really, from my point of view, a mixed blessings for Parkinson patients and family, because the medical advances is good for the patients, but without the community support, that is really difficult for family and caregivers, and ultimately for the patients themselves. We all know and have heard different people talking about how difficult Parkinson's is, and no one probably knows more about the challenges of living with Parkinson's than you. But there's one kind of difficulty that hasn't get spoken a lot about, which I would like to kind of spend some time sharing with you, is talking about the paradoxes, what I call the paradoxes of living with the Parkinson's disease. Because Parkinson's is not, a single set of symptoms. Everybody having it all different ways. And you have many things going on at one time and at a different time. So it's really difficult to even define what Parkinson's is, right? And within that, there's so many paradoxes. So let me give you a few examples. For example, at times, the patient will lose control of their body, right? Of their motor behaviors. But that's not true all the times. There are other times your body works just fine. So that's one paradox right there. Let's talk about emotionally. Some patients have outward blunting of affect. You can't really tell how they're really feeling. And there's a sense of coldness or detachment. But then inside the person, sometimes there's a wealth of feelings and emotions that are waiting to break out. So that's another paradox that patients sometimes often experience. And in relationship, for example, sometimes the patient may seem detached and uninvolved, but at the same time they're very dreadful of being left alone, or being abandoned, or being rejected. So that's another kind of difficult, interesting paradox there. Overall, living with Parkinson's, there's a part of your body that feels like it's dying. But then there's the rest of it that is doing quite well and wanting to live and wanting to grow. Well, the part that is not well needs care, but the part that wants to, venture out and to live normally, wants to try new things. So that's difficult. What about the caregivers? What do the caregivers have to live with similar kind of paradoxes? For example, when would the caregiver needs to help and intervene versus when to let the patient struggle on his or her own? That's difficult paradox right there. Or when to focus on the patient's emotions and help the person dealing with the difficult emotions versus when to just let it be, or when to even expect that the patient pay attention to your own emotional needs, right? Because relationship is a two-way street. That's difficult to sort out. Or for example, when to engage with extended family members and friends and associates and have a normal life, or when to let them go, because it's just too much to handle all of these relationships. That's difficult to sort out. So there are many other examples, but the point here is that these paradoxes are there, and they take a lot of energy because it makes a person going back and forth and not knowing what to do. And I'm not sure there's any answers to any of these paradoxes. To me, it just seems like it's just a quandary that's waiting to work itself out. But I just need to kind of talk about that because that is such a big part of what I could see in the lives of Parkinson's patients and their family. And the other thing I'd like to say about Parkinson's disease is that, it's a silent suffering. The patient suffers it, the family suffers it. It's hard to put words and context around what is really going on. But in other areas, for example, when I work in trauma, when people who come back from war or let's say they've been assaulted or raped or something like that, well, psychology has a very clear path for healing for them. And the path, there are 3 stages to it. The first stage is that we expect the patient to go through a victim stage, meaning that they feel so terrible they just want to get out of a certain situation, a bad situation. Right? And then once they get out, they get into a survivor stage, where they can manage life and live almost as normally as possible, but sometimes without a lot of joy. And then the final stage that these individuals get to is a thriver stage where they can start to feel joy, happiness, they appreciate things. So there are 3 stages. Living with Parkinson's seems in some sense have those stages. Sometimes I see patients and family are really in the victim stage, when you feel so terrible. One person just kept telling me, I see no future. I see no future. I see no future. Everything's dark. Everything's pessimistic. It's gonna get worse. That is a message from the victim state of mind. But then that doesn't last forever. From time to time, everybody learns how to manage, how to adjust, how to get through the day. Life, it's a lot of struggling, but they are able to manage it. So then they get into a survivor state of existing. But then there's also some that I had the fortune to meet. They are spending a lot of time in a thriver stage, where all of the difficulties and hardships have led them to see the finer things in life. The relationship that they have, the fortune that they have, and all of the joys that they're still able to enjoy. So I think for Parkinson's patients and family, it's important to talk about this aspect. How do we get through the victim stage, the state of mind, as well as possible, so that we can spend more time in the survivors and hopefully enjoy something in the thriver stage. And the other thing that I like to say is it is so important to kind of talk more about this is because, with Parkinson's, even for those who have gone beyond the survivor stage and then the thriver stage, every bit of bad news that they have, every complications that with that disease, guess what? It tends to bring you back to the victim stage all over again. Just like when you think that things are going so well, and there's a new problem, or your function just declined precipitously, or something else happened, it seems like it's all started all over again into this kind of victim mindset. So because of this, I have come to realize and discover that it's also very important to talk about mindfulness. You know, mindfulness has become increasingly the one concept and techniques that is being used in the medical field for physical conditions. And I think it is about time to spend some time and talk about mindfulness in the context of surviving Parkinson's for the patient and for the family. And let me just say what I mean by mindfulness. Well, mindfulness is the term that was imported from East and South Asia. You know, this is an area where spiritual growth is really tied into this practice of meditation. And the goal of meditation is to produce mindfulness so that there is some sense of growth in spiritual well-being. The truth is that everybody has mindfulness skills. Okay? This is not an exotic thing at all. And let me just say that in our mind, the simplest way to think about this is that we have two minds. We have the reactive or the working mind, and we have the observing mind. So right now, I'm speaking to you, you're here listening to me, we are all using our working mind. But there is also another mind that is called the observing mind that tells me, I know that I'm speaking. Right? And you know that you are here at the Parkinson's Institute, that you're listening and participating in a forum. So that part that says, I know something's happening, that's the observing mind. Okay? So what happened is that when we're in distress, when we're in a victim state of mind, our working mind, or sometimes I call it the reactive mind, it goes in hyperdrive. You know, it's starting to think, it's starting to catastrophize. Right? It's starting to have a lot of negative messages and ways to try to get out. And so the working mind is very busy. So mindfulness is a thing that to empower the observing mind to be more active. That's what mindfulness is. Okay? So let me give you an example. Let's say a person unsteady on his feet and trip and fall, and it's very painful. Right? So that's a very distressing event. But what could also happen is that because of that fall, the person would wind up, you know, feeling very scared, feeling humiliated, feeling angry, and then starting to, you know, get into just a lot of stress in terms of figuring out how to get out of that situation. But that added energy can make the original pain of falling a lot worse. Okay? So the mindfulness is a way of taking the energy out of that situation. You know, it's like putting your car in neutral and just watch and let the energy kind of work itself out. So mindfulness is really not about positive self-talk. You know, it's not about talking to yourself that everything is going to be fine, everything is going to be great. It's not necessarily about that. It's not about emptying your mind and think about nothing. And it's not about escaping. But it's simply to be observant about what is going on. And why do we do that? Why do we just wanting to just observe what's going on? Because even though things might look very distressing and difficult and painful, it might not be all there is. You know, within an experience of pain or of distress, of suffering, there are small moments where there are no suffering. Or sometimes there's even joy in those small moments. So that's the reason why, you know, mindfulness is being practiced. It's not to anesthetize yourself or do away with, you know, what is bad, but it's to find the small good things that exist in the moment. You know, in the 1960s, there's a famous image of a Vietnamese monk who burned himself in protest of the war, and everybody wonders how he does that. Well, technically, you know, meditation helps a person do that because even though it's a moment of intense suffering, he can find small moments of non-suffering, you know, where there is no suffering, and he lives off of that. And technically, theoretically, that's how it works, you know. So a lot of times, for example, if you can just turn your head and look out that window right there, you know, a lot of time when we're having a hard time, it's almost like we're sitting in a dark room looking out a window that has bars and meshes, right? and then we feel confined. But mindfulness is a way to help us recognize, to see through the holes of the meshes, so that we can see the view outside. Okay, so does that make any sense? Okay. So that's what mindfulness is. It allows us to see what's there and to recognize the positive thing that does exist so that we can make choices. So how do we practice mindfulness? Well, in the past, right here at the Parkinson's Institute, I have a biofeedback instrument where a person can just regulate their breathing, by breathing deeply and gently and rhythmically, and the sensor can really show that the person's heart has changed and the sense of well-being is increased. So mindfulness really, really works. There's not enough time for me to kind of give you a demonstration of that here. We may have to delay that later on. But there are many ways of strengthening your mindfulness. There are many exercises like yoga or Tai Chi or simply meditation that can strengthen the ability to be mindful. And I find that this is a very, very important skill because both patients and caregiver need this. Stress is contagious and relaxation is also contagious. So the more that families are able to practice mindfulness, the more they are able to get through the hard times and be able to get out of a difficult situation a lot better. So the other thing that I also notice is in the caregiving situations, it's also the fear of decline and death, is very, very important. And that sometimes can be very difficult to talk about. That's another paradox. At what point do you talk about decline and dying and making plans for it? And at what point do you talk about just living, making more plans for the future? So everybody deals with these kind of difficult issues in a different way. Many people use the faith to help them deal with these very difficult issues. But one thing that I see that mindfulness is also very important in dealing with the fear of death, in that it is important to talk about and to realize your own personal legacy. The whole idea of legacy is the whole idea that everything that you do in your life, everything that you desires, your values, has a rippling effect on other people. Everything that you do for one person get passed on. You make an investment into somebody, and that is shared and spread out. Just like this facility here, this is the result of the legacy of a lot of people. And now it also includes your legacy. You come in here, you support the institution, you come here to exchange and learn the knowledge, and this is part of your personal legacy as well. So the whole idea is that your personal legacy is going to outlast your mortality, right? So everything that you do as a patient, as a caregiver, is all about leaving something for the future that everybody can always enhance your legacy or change your legacy in the way that you want. So mindfulness is also a way of reminding all of us of that. I think that it's, and from time to time I think it's good to gather your family members, those who are interested in sharing this journey with you. There are many family members who tell themselves that it's not a choice for them to share their lives with you. It's just a matter of how. In other words, it's not a matter of whether or not to help you, to help the patients, but how to help the patients. So then sometimes it's good to kind of gather together and talk about the how. And I would say that to ask for help Even something could be really small. I know my aunt is suffering from ALS, not Alzheimer's, but ALS. It's very difficult, and she lives far away. But she was able to ask me if she can just see me once a week, so that she can share certain ideas. So we have to kind of spend a lot of time writing out what is it that she's trying to communicate. And I'd be more than happy to do that. I'm so glad that she asked. So that you may have family members out there that it may be worth it to ask them. And even if they say no, that they are unable to do a certain thing, but if you can listen, maybe they are saying yes, that they would like to do something else for you. So anyway, I'm kind of covering a very broad area. I just want to kind of maybe give you some ideas and concepts, so later on you can discuss among yourselves and then ask some questions, and I'll be available toward the end of the program to interact with you as well. Thank you.